everybody, and thank you for joining us for the third and final session of our Future of Healthcare Community of Learning series. Today's session I'm really excited about is called Innovating Through Storytelling, Health Campaigns in the Digital Age. Next slide, please. Just a quick disclaimer, this event is made possible by the Indian Health Services Cooperative Agreement Funds. However, it is the sole responsibility of the National Council of Urban Indian Health and does not necessarily represent the views of Indian Health Services or the Department of Health and Human Services. Next slide, please. And for some of you who might be joining us for the first time today, just a little background on the National Council of Urban Indian Health. NCUIH is a national representative advocating for the 41 urban Indian organizations contracting with Indian Health Service under the Indian Healthcare Improvement Act. NCUIH strives to improve the health of over 70% of the American Indian Alaska Native population that lives in urban areas supported by quality healthcare centers. Next slide, please. And just a quick introduction, I'm joined today by my colleague, River Carroll, and he will be helping me to present. He is our Policy and Events Communications Associate here at NCUIH. And my name is Liz Best. I'm a manager of technical assistance. I have a background in public health, and I'm passionate about health communications, health literacy, and also health education and curriculum development. Next slide, please. Great. So as I said, this is our third in a three-part series. And I want to ground us today where we are in this community of learning series. This third session intentionally builds on the last, and hopefully many of you were able to join us for the previous two sessions. If not, the recordings can be found on NCUIH's YouTube page, along with a lot of other really great webinars. We begun this series by focusing on logic models and SMART goals, really grounding ourselves in structure. In the second session, we had a wonderful guest speaker, and we shifted to what innovation in practice looks like. We looked at what implementation can actually look like on the ground. We explored real-world examples of delivery care and services in creative, community-centered ways. And today, we round out this series with storytelling, because the strongest logic model and the most innovative intervention will fall flat if it doesn't connect. Logic models, as we have shown you, gives us the blueprint. Innovation shows us the execution, and storytelling builds trust. And as you'll see, trust is what moves behavior. Next slide, please. So our learning objectives for today, we're going to learn how to use story mapping to co-create health campaigns with community members, centering lived experience and cultural values. We are going to identify practical strategies for meaningfully involving community voices throughout the design and implementation of health campaigns. And then River is going to share his expertise and share with us how to select appropriate digital platforms and impact measures that reflect community engagement, trust, and real-world outcomes. Next slide, please. So why does storytelling matter in health campaigns? We know that health campaigns are rarely made on facts alone. For example, we have known for decades that smoking causes cancer. The data is overwhelming that smoking is not good for us. But many people don't quit because they see a statistic. They quit because they've watched a loved one struggle with oxygen, or when they see someone like them say, "I didn't think I could stop smoking, but I did." Health decisions are shaped by emotion, by trust, and lived experience. Stories help people see themselves in the message, and they can make complex issues understandable. And lastly, people remember stories. We also know that trust in healthcare can be complicated. It's not automatically earned, but storytelling helps build connection and credibility in ways that one-way messaging or data cannot. Think for a minute about the last health message that changed your behavior. Was it a statistic or was it a story? Next slide, please. The storytelling approach is well supported. We love data in public health, but people don't make health decisions from charts. They make them from trust. They make them from emotion, from seeing themselves in the message. Research shows that stories lower resistance. When we feel lectured, we give pushback. When we hear a story, we lean in. Stories help people say, this sounds like me. And when someone sees a person like them navigating a health issue, it builds belief that maybe, hey, I can do that too. They also make complex information stick. Facts inform, stories are remembered. And in Native communities, storytelling isn't just a communication tactic, it's tradition. It's how knowledge and values have always been shared. So when we use story in health campaigns, you are not doing something new. Remember, stories build connection, connections build trust, and trust moves people to action. Next slide, please. So this slide might date myself a little bit, but put a thumbs up if you remember the Just Say No campaign. I wanted to use this campaign. It was a popular campaign in the 1980s. I think it was Nancy Reagan's campaign during the war on drugs. It was simple, directive messaging, telling youth to refuse drugs. In my high school, we had banners all over that said, just say no. It was widely adopted in schools and prevention programs. But over time, research showed that while awareness increased, long-term behavior change was limited. Programs built on this approach did not significantly reduce substance use. The message relied on authority and instruction, but didn't address identity, social context, or lived experience. Now, look at the right, the campaign on the right. This campaign is designed by an organization called the Truth Initiative. In this campaign and many of their campaigns, instead of telling young people what to do, it exposed the tobacco industry, manipulation, and positioned youth as empowered change makers. So in this one, it says, we are the generation that will end smoking. Some of their other campaigns, focus on things like breathing, having bad breath that could be caused by smoking, or things that really relate, to the youth. So it's clear in this campaign that a lot of formative research was done. So the difference between these two campaigns, one message focuses on compliance, the other focused on identity and belonging. And identity and connection, as we see from these examples, is far more powerful than instruction. Next slide, please. Now, hopefully you have a better understanding of the why. But before we move on how to do this work, let's pause for a minute and we'll do a fun activity through Mentimeter. If you don't want to use the Mentimeter, you can certainly put your answer in the chat. And our Mentimeter only goes to, I think, 50 participants, but we might be right on the cusp there. So you can either take a photo of the QR code, or Alyssa will drop the URL into the chat. Give everybody a minute. All right, next slide, Amy. All right, so our first one is a word cloud. I'm curious to know what makes a health campaign feel meaningful to your community. And if this is working right and the stars align, we should begin to see some answers on this page. Honesty, great. Connection, facts, inclusive, relatable, trust, actionable, relevant. These are all really great answers. Transparency, real humans, yep. Real art, yep, very important, especially in Native communities as well. People that look like us. Awesome. Yeah, and these are all things that we're going to discuss in the upcoming slides. Great, culturally relevant. Great. And move on to the next slide. We have another question. Great. So how are stories used in your work today? Option one, we don't really use stories. Option two, we use them occasionally. Option three, we use stories regularly, mostly staff-led. Or four, stories are co-created with community members. everyone another minute. Great. So this is really interesting, and I'm glad that you're all here because hopefully we'll learn some tips and skills today to make stories more co-created with community members, and that's our aim from our learning objectives today. But it seems that most of you use stories occasionally, but let's see if we can get it to option 4 by the end of this webinar. And next slide, please. Okay, and what is the biggest challenge to using storytelling in your work? 1, time or staff capacity. 2, ethical concerns, consent and ownership. And 3, not sure where to start. Great. And I recognize there probably are other challenges as well. Feel free to drop those in the chat. But storytelling and collecting information, it can be time consuming, especially if you don't have dedicated communication staff or public health staff. Yep, there's always ethical concerns, right? Especially if you're using photography or a quote, you might need to, draw up some type of a release form as well. And then number 3, I'm not even sure where to start. So hopefully we'll be able to give you some skills for that in the upcoming slides. Great, and next slide. And thanks for everyone for participating in the Mentimeter. So what storytelling makes possible in health campaigns? Storytelling makes several things possible in health campaigns that data alone cannot. So take a look at these boxes and then think of an example or maybe a poster or a radio campaign. So instead of posting, we did some work with 988 here, a poster that says 988 is available 24/7, call or text if you're in crisis. So that's really good data and facts. You have the number there, you know why you're supposed to call if you're in crisis. But now think about if we shift it. So if there was a poster or a radio ad that said, when Maria lost her job, she didn't think she was in crisis. She just felt overwhelmed. A friend texted her about 988. She called. She said the first thing the counselor told her was, you don't have to carry this alone. So now we see that the service, it's not just a number, it's a human experience. We've reduced stigma by telling story. And it also shows what happens when you call. You'll be met by a caring operator on the other end who will have, a helpful message to share. That's what storytelling makes possible. Next slide, please. Here at NCUIH, we do a lot of storytelling, and I just wanted to share some examples that we have. Some of them are print. A lot of these that you can find on our website. These are 2 new posters that were recently created. So if we look at these 2 posters, they work because they do more than share information. They reflect identity. These, I think they use familiar imagery or cultural elements. They speak in a language that feels human and not institutional, which is really important in healthcare. They focus on lived experiences instead of abstract statistics. And they show people, not just services. They don't say, here is a resource. They communicate, this is for you. The little purple one, I couldn't get our video because it's on TikTok now behind a private browser. But for many years, NCUIH partnered with our youth council to co-create mental health campaigns. And that word co-create really matters. We didn't hand our youth a finished message and ask them to promote it. We helped mentor our youth council. We gave them structure, we gave them tools, and they built the story. Our most recent youth council campaign focused on mental resilience, but through culture, not clinical language. Here at NCUIH, we help them by providing a project plan, clear guardrails, and then support in moving from their idea to execution. But the youth, they chose the direction, they chose the platform. They selected TikTok, and many of us here at NCUIH weren't as familiar with it at that time. And they created short form videos connecting resilience to humor, cultural identity, and intergenerational strength. This campaign really resonated because it was the authentic youth voice. And that's the key. We didn't start with them and say, hey, let's use TikTok. We started with, what do you want to say? And then the platform followed their purpose. And that brings us into digital strategy, because once the story is right, the question becomes, where does it live and how do you create it? Next slide, please. So getting started, you don't need to launch a campaign to start storytelling. You need to start with listening. And that's listening around your clinic, listening to your own children if you have them, listening to friends and how they're reacting to certain campaigns. So always having your ears ready, but start by listening. Next slide, please. This is just like a little simple framework that I made with the word story. It can help you to remember. So S, start with listening, as we said. Build trust before tactics, especially if you are using stories. So be transparent that you're thinking about a campaign and how you might be able to engage your community. O, ownership stays with the community, right? So showing them anything that you might produce beforehand, before sharing it with the community. R, relate stories to the purpose, and they might change year by year, different campaigns. And then Y, you don't finish the story alone, right? So I think it's always good to have testing or evaluation depending on how big the campaign might be. Next slide, please. I really love this slide. This is some work that NCUIH did. We do a Hope for Life Day campaign. We have a really great toolkit. Hope for Life Day is September 10th. That can be found on our website. This year we were at a conference and we were able to participate in a booth. So you'll see some posters that we have that say, reach out to a relative and stay connected. But we also did a two-way campaign where we just made these little postcards that said hope is. And then anyone that visited the booth had an opportunity to write on there what hope meant to them. If they wanted, we snapped a photo of them with their postcard. And we have a gentleman here. He says, hope is with all of us through resilience. So this was everybody's individual story. And then by posting them on our at the conference, we were really able to make a community effort. And it was a highlight, I think, of the show that we were at the conference that we were at. And we were really proud of this work, and we shared it on our social media as well. So just some quick tips: engage the community early before messages or materials are developed. Create a space for listening, not just feedback. Be clear how stories will be used and who will benefit. Respect consent, choices, and boundaries. Build trust over time and not just one campaign. Next slide, please. There are a lot of different tools that you can use. This slide here introduces something called story mapping, which is a simple framework that helps turn lived experience into a clear, purposeful narrative. It guides people to reflect on where their story begins, what changed, what action was taken, and what message matters most. This is just a way to give structure to storytelling so it's intentional and aligned with your campaign goal. And next slide, please. And these are just sample storytelling questions. I think it's always great to start with a map. I didn't make these up. These came from a storytelling guide. But this can just give you just a little roadmap or path, on how to open up, to begin with the storytelling technique. So asking people to tell me a little bit about yourself and your community. From there, you might learn what campaigns are necessary. What was life like before the health issue became part of your story? and then moving through what the challenge would be, what action was taken. And from there, you will come to your call to action or message. But as you begin your own health campaigns or storytelling, of course, questions will be unique to your community and the type of stories that you want to tell. Next slide, please. And with that, I am going to pass the mic to my colleague, River, who is more of the expert in digital platforms and social media. And I'm excited for what he's going to share with you.
Thank you, Liz. Hello, everybody. My name is River, and I think Liz made an important point earlier on when we were talking about the differences that you see when storytelling in the digital spaces, and that I also agree. You don't want to start with the platform, but what your goal is. And oftentimes in these spaces with health campaigns, are we trying to raise awareness or build trust, especially in the vaccine space? Drive registration. We've done many get out the vote campaigns, which were really awesome. We had some really cool graphics that our design team made. And each goal requires a different digital behavior. So here you can see we have a few of the popular ones and what you could associate each platform with, essentially. Instagram being quicker, more visual, more aesthetic centered. People want to repost on their stories now. Facebook, especially in native spaces, that's where my grandma's at, my aunties are at. They're all chatting in the comments, sharing messages. LinkedIn, it's pretty professional. That's where we put our research, our policy blogs, resources for our urban Indian organizations across the country to use. And then our email to stay consistent with our messaging, and your website to have a permanent resource hub. Many can make the mistake that just posting anywhere, posting the same thing everywhere is the same thing. But we believe that the story can be adapted for each platform and each platform's strength. And so when we design, we try to design for how people scroll and not how we wish they would. And I didn't put on here but also YouTube. We've seen a uptick in our views on YouTube on our channel. People are really interested in long form video content now too. So that might be something that you could consider. And it's easy to do. It doesn't require overproduction or editing. It's you can just talk and conversate, and that's something that we've been doing on our podcast as well. Next slide, please. And so measuring what matters, this is what kind of trips up a lot of comms teams is which statistics you should rely on and which ones you should prioritize, because each platform, they have likes, they have comments, they have reposts, but not all engagement is equal. So it's easy to focus on the likes, the impressions, and your follower growth, because those numbers feel good, but they don't always tell us if our message has worked. And so in health campaigns, especially in Native communities, what matters is the behavior change that we can see. Did someone save the post because they plan to reference it? Did they share it with family? Did they click through to register? We check attendance. Did attendance increase? And did our resources get downloaded? We can track that as well. And so those are impact metrics that kind of show you what's working, what's not, what is worth more time and investment. And every campaign should have a clear action in mind, and every metric should connect back to that action. If it doesn't, then you're kind of just producing content, which we can do for fun. But if we're spread thin, some people have small teams, you really want to focus on impact. And so that's an important part of it. And next slide, please. I think that is, yes. Pass it back to you, Liz. Thank you.
Great, thanks, River. And here are just some resources. Again, these slides will be shared out, but they're just some resources on how to get started. Additionally, you will find on NCUIH's website, sometimes you don't always need to reinvent the wheel if there are great campaigns. I know organizations love when material is shared, especially from social media. That's a great way for engagement. So if you're not familiar with our work and our campaigns, feel free to visit our website. We have a lot of great vaccine campaigns, behavioral health campaigns, etc. And next slide, please. Great. And with that, I'll pause and see if anybody has any questions or thoughts, or even sharing just some great work and resources that you might have created. Feel free to drop a question in the chat, or you can come off your mute as well. All right, so I see no questions at the moment, but if you do think of any, please feel free to put them on the chat as we close out. Next slide, please. These are just some references that accompany the slides. And next slide, please. If you wouldn't mind, please taking a moment to fill out the survey link. This will help inform future webinars. You can always put in different topics as well. We're always looking on things that our audience would like to learn more about. And this will be sent out with the slides as well if you don't have time today. And next slide, please. Great. I wanted to share some work of my colleague, Alyssa, who's been graciously dropping things into the chat. We have this great RSV toolkit that was created, and some of the graphics that I shared today are in this toolkit, but feel free to share with your networks as well. And next slide, please. NCUIH also provides one-on-one technical assistance, primarily to UIOs, but we are able to help others as well. If you do have a technical assistance need, please let us know. We are able to help also with communications efforts as well. So there is the link that will be dropped in the chat by Alyssa as well. Don't hesitate to reach out. And next slide, please. So just some upcoming events. We have a great webinar that my colleague Nala and myself are working on. It's called Rethinking Nutrition, Why Traditional Foods Matter in Wellness and Beyond. This will be offered for CEU credits, and we do hope that you're able to join us on that. And then we're really excited and hard at work at our annual conference, which will take place in Washington, D.C. from April 27th through the 30th. I think there's still early bird special for another week or two for registration. And I do see a question. At Bakersfield, we're currently working on making a guide for urban natives to participate in sweat lodge ceremony for those who never have and may feel intimidated. Any advice on managing multiple tribal beliefs would be appreciated as well. And I think that's a great question. You know, as we think on how to make things inclusive. And again, I think just, you know, modern and relevant photography can always be helpful, or even just taking photos and using photos as part of the story can be particularly, I think, impactful and powerful as well. Thanks for that question and comment. And River also put some of our socials in there as well. We have a lot of great content always coming out. And next slide, please. If you haven't subscribed to our newsletter, this is also a great way to learn more about the work of NCUIH, but also when we do public health campaigns or communications campaigns or have a new resource to share, we do post those in our newsletter. So it's a great way to receive those. And last slide. Great. And with that, we will close out if there's no more questions. This format for this community of learning, they were kind of lunch and learns, 30 minutes, just hoping to give you guys some new information and some quick tips. And I really hope you join us again for our next webinar next month in March. And hopefully we'll see many of you at our conference in April. Thanks so much for joining.